day and welcome back with Work It Out Workshops video series. Today we're joined with Dr. Zudian Coleman. She is a board-certified chiropractic doctor serving in the Atlanta area for over 5 years. And she heads the Physical Medicine and Chiropractic Department at Anwan Wellness Medical Center here in Tucker and in Hapeville. And she has a wealth of knowledge and experience in the wellness field. So welcome, Dr. Z, as we affectionately call her.
Thank you for having me on your show.
So tell us a little bit. What I want to know is why would one go to a chiropractor? Tell me a particular reason. Why would one go see a chiropractor?
Well, it's funny because most people consider us the car accident doctors.
Right.
And in fact, we've been put in that that small bubble. But however, we are preventive doctors, and what we do is we help people maintain their bodies. And so, you know, especially for women, you know, I see there are a lot of benefits for chiropractic for women, as far as taking care of, you know, reducing stress, improving fertility, improving joint function. Headaches is a major thing that I see in my office for.
Oh, so people can come to a chiropractor for headaches.
Absolutely.
So tell me a little bit. What do you mean? I can't take a Tylenol and be good?
Well, you know, Tylenol is just covering up the problem. Okay. What the pill does, it actually just signals your brain that you're not feeling any pain. But the problem is still there. And the condition that some people have is cervicogenic headaches. That means that the origin of your pain starts in the neck. Mm-hmm. And then it starts to radiate up into the head and create this tension headache. Okay. And so releasing that tension and also aligning the spine definitely helps people reduce and eliminate their headaches. And so with a gentle adjustment, you know, you can actually lose the goody powder, the everyday taking a Tylenol, which eventually affects your digestive system.
And how long would that type of visit take to help eliminate that?
Well, you know, every patient is different. So, you know, it depends on how long you've had your problem too, and what other things have occurred over the time. Because if you've had some structural issues and they've been there for a while, you can, you know, cause arthritic changes and so forth. So if we can get you in the office as soon as, you know, educate people so they know they can come to us, you know, immediately. They don't need a referral or anything, and we can check them out and make sure that we get to the problem as soon as possible.
I understand that women can be helped seeing a chiropractor who have fertility issues.
Absolutely.
Wow.
Yes.
Did anybody think of that? Go to a chiro and you have fertility issues?
You know, the thing is, and this is the basis of chiropractic, is that structure affects function. Okay, and that's just a law all across the board as far as science. So if the structure of your pelvic is off, then, you know, there's a reduction in, you know, the fluid. You know, when you ejaculate and everything is off and you have a shift in the pelvis, then it's very difficult for someone to have a baby. So we've actually seen many times through chiropractic therapy and some care and working on the pelvic region that we've helped people being able to have children.
Wow, that's interesting. So what are solutions solved by regular maintenance and chiropractic care?
Well, you know, you want to look at going to a chiropractor like going to the gym. It's part of your regular daily activity or lifestyle. It's part of your lifestyle. Okay, so we all should be working out and going to the gym. The same thing, we all should see our chiropractor. You know, depends on your situation. You know, maybe once a week, maybe once a month, maybe once a year. It depends on how often you're using your body, because your body's like an engine. So, you know, just like your car, you know, you want to maintain your car after a certain mileage. Same thing with your body. You want to maintain your body over, you know, if you've been using it a lot for certain things. So how often and how regular should someone come in? It all depends on their own situation. One of the things that I noticed that my chiropractic patients, they tend to spend less in total health expense because they've been maintaining over time. So you can cut your cost in health care, cut your cost in your children being sick and you being sick and out of work and losing money that way. And also increase your ability to live longer and be able to enjoy a nice balanced lifestyle.
I agree with that. Personally, I do see a chiropractor myself. I go for maintenance once a month. And I find just for it to help keeping me some of the stress off of my shoulders, and for you ladies, I like to wear a lot of high heels. So the chiropractor, they tell me about it, but I'm still in my high heels.
But as long as you get in maintenance, it can actually reduce some of the problems that those things can cause over time. But with common solved problems that we have in our office. It's not just back pain, but we've had people with headaches, joint extremity issues, like we're talking about wearing heels. If you're an avid heel wearer and you want to stay in your heels, you can get therapy, come to us, and we can adjust the heels. We can adjust your elbows. You can adjust the extremities and help you to stay off some of those medications. I also heard
that I have a colleague that sees a chiropractor for carpal tunnel.
Yeah, absolutely. As a matter of fact, carpal tunnel is the most misdiagnosed problem. And most of the time, a lot of people have gone to surgery and realize that the problem hasn't been solved.
So what would a chiropractor do for someone that had carpal tunnel? Well,
we usually go to the cause of the problem. We try to start from where the source could be first. So, after an adjustment, first we take an x-ray, and most of the time, most of those people have issues in their neck anyway. And, when the bones are out of alignment or pinching on a nerve, or you have any arthritic changes in your neck, that can actually cause, in different segments, radiating pain down the hands, and it can go all the way down to the wrist.
So a lot of people think that the carpal tunnel starts here, but actually this is a late diagnosis of some issues.
Well, actually, it's not that misdiagnosed carpal tunnel mean that it wasn't carpal tunnel from the beginning. It was probably something from the neck. So a real carpal tunnel does it's in the wrist.
Okay.
But if it's misdiagnosed, that means they missed the fact that it started in the neck, and it's not necessarily.
So going to a chiropractor on regular maintenance, that would help decrease that, especially for those who are typing
it's not only just people who are typing, and we all have these computers where we have our own handheld devices and phones. We've had people with thumb issues. So, any of those issues can be addressed at a chiropractic office, and if it's something that's beyond our, scope of practice, we can certainly refer it out to a hand specialist, even with the external, like a podiatrist, so that they can actually go further with that care.
So what other alternative services do you offer over there at Anwar?
Well, the great thing with being at Anwar Medical Center is that we have our medical doctor there, we have our podiatrist, we have a pediatrician, an internist doctor, internal doctor. So we can really affect the health of someone holistically, along with the chiropractic and physical therapy. The things that we do in our department includes a foot bath detox, helping to cleanse the body. Of course, that's very important. And, you probably have other shows talking about detox and how important that is to your health. We also do anti-aging. So, we work on helping to balance hormone, which is another issue that I find in a lot of women and men. We also have massage therapists. So we do massage therapy, dealing with the stress issue, dealing with musculoskeletal issues. And of course the chiropractic part, which, if you've been in a car accident and you have chronic issues or chronic problems as far as neuromuscular or musculoskeletal, we can actually help you with that too. So it's pretty comprehensive when you're, if you're a patient with us.
How insurance friendly is this service?
Okay. Well, you know what? Most insurance do accept chiropractic care, but they won't accept the alternative care as far as covering, foot bath detox and hormone therapy. Chances are maybe hormone therapy, but some of the other holistic things they do not cover. They may not cover for preventive, which is a major issue, and we really should talk to our counsel people about pushing that, because when we prevent, we can actually cut our cost of healthcare, which is an issue in our country right now. So once we, as far as money, we make it's very affordable by, care plans, okay, that you can actually pay as you go, and, make sure.
So there are care plans, because I think that's a lot for some people who want to do holistic care alternative, the
cost.
cost has really deterred a lot. But knowing that there are payment issues and to invest in yourself, to invest in your health, is that's you can't get wealthy, you can't have a better lifestyle unless you invest in yourself.
Well, the other thing too, a lot of people have lost their insurance
Exactly.
from loss of job, and so that care plan has come very important right now.
So, Dr. Zudian Coleman, she has a Z Chiro Med Spa is a unique blend of luxury and clinical efficacy. The Z Chiro Med Spa experience balances science and nature to provide long-term well-body health and wellness. Wellness that goes beyond your aches, joints, and pains. Absolutely. Thank you so much, Dr. Z, for joining us here at Work It Out Workshop. We'd love to have you come back and join us in a panel discussion.
Thank you.
Thank you. Okay, Atlanta, so here it is. Work It Out Workshops, where you are inspired, where you can become empowered, where you are encouraged. Here, Work It Out with Work It Out Workshops.